my name is Kelsey Ortman, and I'm a nurse practitioner student through Maryville University. This is my head-to-toe assessment. This is my volunteer patient. She's a 60-year-old female. Before the exam, I started by having her empty her bladder. Normally, on an actual patient, I would go ahead and have them change into a gown, but for the sake of privacy, I went ahead and let my volunteer patient keep her clothes on. I went ahead and also took a full set of vital signs, which were all normal, checked her height and weight, went over the results with her, took a full history, and then we went ahead and tested her visual acuity with the Snellen chart, which was testing cranial nerve number 2. She scored a 20 out of, she had 20/20 vision in each eye, which is a normal finding as well. Now go ahead and move into the physical assessment portion. We'll start by looking at her head and her face. Her head is symmetrical, round, even. There's no obvious deformities or abnormalities. Her skin is intact. There's no obvious wounds, lacerations, bumps, no obvious deformities, no swelling anywhere. And now I will go ahead and palpate, or I'll go ahead and have you, I'll test cranial nerve number 7. If I could go ahead and have you smile for me. All right, now stick out your tongue, puff out your cheeks, close your eyes really tight, wrinkle your forehead. All right, so like I said, that was testing cranial nerve number 7, which was intact. I'll go ahead and now palpate her scalp. Her hair is thick, there's no areas of alopecia. I don't feel any bumps or deformities. Her facial bones are all intact again, no bumps, swelling, tenderness, or abnormalities. I'll go ahead and palpate her sinuses. There's no pressure when I'm pushing on any of them. You can go ahead and clench your jaw for me. Feeling her TMJ, which is intact. There's no clicking or crepitus, which is a normal finding. I'm going to go ahead and now test cranial nerve number 5, which is light sensation. First, I'm going to have you feel what each one feels like. This is sharp, this is soft, and this is dull. All right, you ready?
Dull, soft, sharp, soft, dull, soft.
Okay. She had proper feeling in her face in all regions. Her cranial nerve 5 was intact, which is a normal finding. I'm going to go ahead and move into her eyes now. Her eyebrows are blonde and thin, but they are intact. They do extend to her outer canthus, which is a normal finding. There's no ptosis in her eyelids, which is a normal finding. I can see her lacrimal glands don't have any drainage coming out of them. There's no abnormal redness anywhere. Her sclera is white. Her conjunctiva is pink and intact. There's no sweating or abnormality there. Touching her lacrimal apparatus, there's no swelling or edema. There's no tenderness on palpation. Now I'm going to go ahead and check her pupils. We had already done her visual acuity test, so we don't have to do that in the eye portion. Okay, her pupils are equal and reactive on both sides. Now I'm going to go ahead, check for a red reflex, so if you just go ahead and look straight at me. Okay, her red reflex is intact in both eyes. And now if we could go ahead and do the cover-uncover test, if you could just cover one eye and look at me. Okay, great. Go ahead and do the same on the other side. Okay, great. There was no nystagmus when she covered the eye. There was no deviation. Her eye kept looking straight forward, and it was symmetrical on both sides, which is a normal finding. Now I'm going to check her ocular motor, which is cranial nerves 3, 4, and 6. So if you could go ahead and follow my finger. Very good. And confrontation. Okay, her eyes followed my finger the whole time. There was no nystagmus or deviation during it, so her cranial nerves are intact there. So now I'm going to go ahead and take a look at her ears. They are symmetrical on both sides. They extend to her outer canthus. There's no obvious abnormalities on either side, no swelling or wounds of any sort. I'm going to go ahead and palpate the auricle. Okay, there's no bumps, no abnormality. I'm not feeling any wounds. There's no tenderness when I'm touching. I don't see any drainage when I get closer. I'm going to go ahead and test her hearing, and this will be testing cranial nerve number 8. If you could go ahead and occlude this ear, I'm going to whisper 3 things to you. 3 blue dog.
3 blue dog.
Okay, perfect. I'm going to test this side.
7 yellow bird.
Okay, perfect. Hearing is intact on both ears. I'm going to go ahead and use the tuning fork and test her ear and bone conduction. Do you hear it equally on both sides?
Mm-hmm.
Okay. Now I'm going to test air versus bone conduction. Let me know when you stop hearing it, okay?
Okay. Yep.
Okay, so air conduction was twice as long as bone conduction, which is a normal finding. Now I'll go ahead and test this side. Let me know again when you stop hearing it.
Okay. Okay.
Okay, so once again, her air conduction was twice as long as bone conduction. So normal findings. Hearing was she can hear in both ears equally. Also, the fact that she's responding to my questions appropriately. There's been she hasn't asked me to repeat anything, so her hearing is totally intact. I'll go ahead and take a look at her nose now. Her nose is symmetrical. It's midline in her face. There's no obvious deformities, wounds, bumps, or anything like that. I'll go ahead and palpate. Again, I don't feel any bumps. There's no tenderness, no extra swelling, no deformities or bumps here in her nose. Looking at her septum, it is equal in alignment. It is midline. It doesn't deviate to one side. I'll go ahead and take a closer look of her nose now. Okay, her mucosa is pink and moist. There's no redness or bumps up there. It doesn't look like she has any allergies. Her turbinates are intact on each side, pink. Her septum, again, I can see further up is still midline. There's no deviation to one side. Now, if I could go have you occlude one nostril, take a breath in. Go ahead and occlude the other one, take a breath in. Were you able to breathe equally on both sides?
Mm-hmm.
Okay, so both of her nostrils were patent, which is a normal finding. I will go ahead and take a look at her mouth now. So I went ahead, if you could smile for me. Okay, her smile is still symmetrical, which was cranial nerve number 7, which we tested. Now I'm looking at her lips. They are pink, they're moist, there's no cracks, no deformities, no wounds on them or anything, no swelling or edema, no bruising. If I could go ahead and have you open your mouth for me. So her buccal mucosa is pink, moist, totally intact, no swelling, no drainage anywhere. Her hard and soft palates are intact. The floor of her mouth is pink, moist, and intact. Her gums are pink. I don't see any bleeding or any irritation anywhere. You can go ahead and stick your tongue out for me. Her uvula is midline. It is intact. There's no swelling on it. She told me earlier before the exam that she had her tonsils removed, so I do not see her tonsils anywhere, which would be a normal finding for her. Her tongue was pink and moist, and it's symmetrical. If I could go ahead and have you stick your tongue out again. All these tests will be testing cranial nerve number 12. Move it side to side. Okay, lift it up. Okay, her tongue moves freely, so her cranial nerve number 12 is intact. Now if you could go ahead and say ah for me.
Ah.
And then I'm going to test your gag reflex, and these will be testing cranial nerves 9 and 10. All right, cranial nerves 9 and 10 are intact. Now I'm going to go ahead and move into her neck. Her neck is supple, it's midline, there's no JVD, there's no tracheal deviation. I will go ahead, palpate her trachea. No midline, or no deviation, it's still midline. If I could go ahead and have you swallow. Okay, I can palpate her thyroid when she does do that, but it does feel a little bit small, which could be a sign of hypothyroidism, but normal finding within her exam for now. I'm going to go ahead and palpate her carotid arteries, but do this one at a time. Okay, and now if I could go ahead and have you lift your shoulders up against me, move your shoulders out against me. When I put my hand on your face, push against me. Okay, all right, her muscle strength is intact. I can go have you shrug your shoulders, move your neck in a circle. She has good active and passive range of motion, which is cranial nerve number 11, her shrugging her shoulders. I'm going to go ahead and palpate her lymph nodes now. We got her pre-auricular, post-occipital, cervical, into her submandibular, submental, cervical, deep cervical, posterior cervical, her supraclavicular, go ahead, her infraclavicular, lift your arms up for me, her axillary, there was no, you can go ahead and rest your arms down, there was no swelling, none of her lymph nodes were swollen, there was no tenderness when I was palpating all of them, which is a normal finding. Swollen lymph node could be indicative of an infection or cancer or something like that, but there was no swelling or abnormality. Now I'm going to go ahead and auscultate her carotids. And then into her thyroid. Okay. Upon palpation, there was no thrills earlier listening. There's no bruise, there's no whooshing. These are all normal findings, no abnormalities upon listening to her thyroid. I'm going to go ahead and now move down to her shoulders, arms, hands. Her skin is all dry and intact, no obvious deformities, abnormalities, swelling. There's no skin lesion, rash. She's not complaining of any pain or anything like that. Moving down to her hands, skin is still pink and intact, normal for ethnicity. There's no wounds on any of her, on her hands, arms, or shoulders or anything. Her nails are totally intact. They appear strong. There's no brittleness, no breaking. She's got good cap refill in both fingers, on both fingernails. There's no cyanosis, showing that she's getting good perfusion throughout her extremities. So all of this is normal. Go ahead and just touch your arms again. There's no pain on palpation. I don't feel any bumps or anything. This is all normal. I will feel for her brachial arteries. And now her radials. Radial and brachial pulses are both 2+, normal, easy to palpate. These are all normal findings. I'm going to go ahead now and take a look at her back here. I'm going to lift your shirt up a little here, ma'am. Okay. So her skin is dry, it's intact. Her thoracic spine is midline. There's no kyphosis or bulging. Her respirations look unlabored from the back, no respiratory distress, difficulty breathing, all the way down to her back, no CDA tenderness upon palpation or upon percussion. I'm going to go ahead and auscultate her lung sounds now from the back side. Take some deep breaths for me. Okay, breath sounds are all clear, all vestibular or bronchial vestibular, which is a normal finding. She has good air movement. She has good diaphragmatic excursion. I'm going to go ahead and percuss. Lateral. Okay. She had normal percussion. Also, again, bronchial, vestibular, percussion. I'm going to go ahead and do tactile fremitus. If you could just say the word 99.
99.
Okay.
99. 99. 99.
Okay, she does not have tactile fremitus, which is a normal finding. I'm going to go ahead and take a look at her anterior chest. Again, there's no rashes, there's no bumps, no obvious abnormalities. Her skin is within defined limits, it's intact. I'm going to go ahead and once again, her breathing from the front, there does not appear to be, she's not grunting, air, she's not gasping for air, anything, no respiratory distress, totally unlabored, breathing about 14 times a minute, which is a normal finding. I don't hear any adventitious sounds even before before auscultating, which these are all normal. I'm going to go ahead. Okay, again, good air movement in the front. All breath sounds are clear. Percussion. Good percussion in all of her lung fields, posterior, anteriorly, and laterally, which are all normal findings. Good breath sounds, auscultating. I will go ahead and move more into the cardiac portion of the assessment. I will palpate her precordium. There is no thrill, no heave, no abnormal palpations. Feel her pulse feels normal, no irregularity there. Listen to her apical pulse. Okay, I'm going to go ahead and listen to all of her heart sounds. Pulmonic, aortic, herbs, tricuspid, and mitral. So she had normal heart sounds, S1, S2, no palpations, no murmurs or anything like that. Everything sounded fine. So now I'm going to go ahead and test tactile fremitus from the front. Just say 99.
99. 99. 99. 99.
Okay. Now if I could go ahead and just have you lay on your left side here. If I could have you lay all the way down. Sorry about that. Okay. Once again, feeling her precordium and apical pulse. There's no heave, no abnormal no abnormal pulsations, no thrills. These are all normal findings. If I could go ahead and have you sit up. I went ahead and palpated her axillary and her infraclavicular nodes while I was testing all of the other ones at once. So now I'm going to go ahead and take a look at your abdomen. If I could go ahead and have you just lift your shirt up for me. So it's skin is normal and intact, a little bit rounded but not distended. No obvious hernias or anything like that, which is a normal finding. I don't see any abnormal pulsations. So now I'm going to go ahead and auscultate all of her bowel sounds. Okay. She had active bowel sounds in all 4 quadrants, which is a normal finding. I'm going to go ahead and now listen to all of the arteries that are in her abdomen, starting with her aorta, renal, iliac, and femoral. No thrill or bruise in any of her arteries, no abnormal pulsations. Her arteries were all normal in her abdomen. I'm going to go ahead and now percuss all 4 quadrants. She had tympany in all 4 quadrants, which is a normal finding. I'm going to go ahead and percuss her liver over here. When you hear dullness, that is when you know you're over the liver, so you're able to actually percuss about how big someone's liver is. Her liver is normal size. Go ahead and percuss for dullness to see her spleen over here. Okay, so I'm able to percuss dullness over there in her spleen, which is a normal finding. I'm going to go ahead and start with some light palpation in her abdomen. Is there any pain when I'm palpating in any of these areas?
No.
I don't feel any bumps or bulges or anything like that. There's no tenderness when I'm palpating. I'm going to go ahead and do a little deeper now. Let me know if you feel any pain.
Nope.
No pain, no rebound tenderness when I'm touching her in any of these spots. I'm going to go ahead and palpate her liver, which is on the right side over here. Is there any pain when I'm palpating over here?
No.
No? Okay, so her liver is palpable and is normal. I'm going to go ahead and try to feel for her spleen. I do not feel it, but that is totally normal. Feeling someone's spleen would actually be an abnormality. Could be indicative of an infection such as don't want to ruin this now. It could be inside of an infection. So now I'm going to go ahead and palpate her kidneys. No, go ahead and lean back on me.
I'm sorry.
You're fine. Okay. Kidney is palpable. This kidney is also palpable. I can feel her abdominal, her aorta pulse, but it's not like abnormal. It's not bounding or anything like that. It's equal. Now I'm going to go ahead and if you could just lean up a little bit. Her muscles are intact. There's no splitting in the muscles. Her abdominals are symmetrical. Now I'm going to go ahead and start moving down her legs. Skin, first off the bat, just again, no rashes, lacerations, no edema, no obvious swelling, abnormalities, deformities of any kind. They're dry and normal for her ethnicity. So now her muscles appear to be symmetrical on each side. There's no like atrophy of her muscles. She doesn't actually have hair on her legs because she's shaped, so that is a normal finding. There's not like a side that has abnormal growth of hair or anything like that. So now I'm going to go ahead and palpate your pulses here. Pedal are intact. Posterior tibial are intact. And then palpateel are intact. So all of her pulses are intact. So her skin was dry and intact. It's also warm. She's not diaphoretic. It's not hot. It's not cool. So it seems like she's getting good blood flow down to her legs as well. She's got good cap refill in both of her toes. Testing for edema. She has no edema in her feet or legs. There was no tenderness. Does it hurt when I'm squeezing back here? No tenderness in her calves, like no indication of her having a DVT in any of her legs. So I've actually completed all of the cranial nerves throughout this assessment. The only cranial nerve we did not touch on was her sense of smell. So I could have her occlude a nostril, smell things, but it appears as if her sense of smell has been intact. So now I'm going to go ahead and test sensation. So just like we did on her face, I'm going to go ahead and test sensation on her arms and her legs. So again, this is sharp, this is soft, and this is dull. Go ahead and close your eyes for me.
Sharp, soft, dull, dull, soft, sharp, sharp, soft, dull, soft, sharp, soft.
Okay, so her sensation is intact in all of her extremities, which is a normal finding. Now I'm going to go ahead and test for her reflexes. We'll go ahead and start with the brachial. Okay. Okay. Brachial is intact. Test her patellar here. Go ahead and try to relax your leg as much as possible. Okay. And then the Achilles. Okay. Reflexes are intact in all of her extremities, which is a normal finding. I will go ahead and inspect the rest of her spine. We went ahead and looked at her thoracic spine while we were looking at her back. Same with thoracic. I don't see any kyphosis, no bulging. It's totally midline. There's no deviation on each side. Same with lumbar spine, no kyphosis, no outward bulging, no deviation. It's all midline. There's no pain when I'm palpating either site, which is all normal. So now I'm going to go ahead and test for muscle strength. If you could go ahead and squeeze my fingers, pull me in towards you, push me away. All right, go ahead and wiggle your toes for me, push down against my hands, pull up. Okay, don't let me push your legs down, okay? I'm gonna lift them up a little bit. Push against me. Great, all right, she's got great strength in all of her extremities, which is normal. Now if I could go ahead and have you just stand up and just do a squat down. Okay, so muscle strength is intact. She's able to squat down, she's able to move. If you could take a few steps for me. Great, she's got normal gait, no unsteadiness. I think this might conclude our exam. Do you have any questions for me today?
No.
Okay, that concludes our exam. Thank you very much.